Okay, I think I want to go ahead and start here. We have a quorum now, so we're going to start our first meeting of the year, and I'd like to welcome everyone. I don't think it's necessary to go around and have introductions. People will get a chance to speak, and when you speak, say who you are and your role. So we know who's talking. Sometimes people don't have on video and it's only their phone, so we'd like to hear. I'm going to do, you have your agenda in front of you, but I'm going to take the prerogative of moving things around a little bit, and I think you'll see why, or what the logic is as we get into it. But first thing I want to do is, as is customary, to have approval of minutes. Now, the minutes weren't published, but they were sent to everybody to listen to the recording. Does anybody have any additions or corrections to the minutes? No. Can I call for approval?
So moved. This is Moira Richards. So moved.
All in favor, raise your hand. How's that idea? Okay, I think we have everybody. We're good. Okay. Ordinarily, I would move to committee vacancies, but there's going to be a little confusion about that, and you'll see why in a minute. What I want to do is Sanel going to be handling the Office of Newborn Screening Data. Is Sanel going to be doing that, or who's going to be doing that?
Wendy will be presenting that.
Wendy, if you don't mind, I would like to do that first, because I think our discussion is going to be pretty heavy, and it might end up we don't get to this, but I really want to get to this. So you want to do that discussion?
Sure. Let's go ahead. And I have it up on my screen already. So hopefully you were able to access the information I sent you yesterday. For some reason, Google was making me send it as a secure email. I tried to not. To make it easier. So hopefully you didn't have any problems with it. I want to mention that we did slightly edit the information. So I'm going to post this information that I'm showing you today on the website, and of course send it to you after, so you'll have the most updated one. They're very minor changes, but just wanted to make sure it was accurate and you got the right information. So just kind of start off the bat, this is our hearing data, 2018 and 2019. This is kind of the information that we've been sending, that we've presented in years past. So you can take a look at those numbers and let me know if you have any questions.
Yeah, feel free to ask questions as she moves through this.
Right. Yeah. Because I'm going to go kind of fast, hoping that you've already looked at it, and I don't want to just read off charts. So
I understand.
So Wendy, this is Lilas, and it looks like the math may be wrong on the first one, because you've got 188 permanent cases, but the numbers below it don't add up to 188.
True.
And they don't quite match what was sent into CDC. They're really close, but they're not exactly.
It should be 190.
Should be 190. Yeah. Okay. I had pulled that from the High Track CDC survey.
Yeah, the CDC survey that was submitted is a little bit different.
Oh, okay.
So and they don't quite match here. So but they're very close. So it's not statistically, I don't think there's a big difference in what you presented here versus what the reality is. So
okay, no, but that's good to know. So I will make sure that I double check that before posting it. So thank you.
I'm actually impressed on how similar the numbers are.
Okay, go ahead.
This is Arturo, a pediatrician in the Valley. The 2019 numbers and 2018 numbers are for permanent hearing loss and initial diagnosis are 188. Are those the same patients that are recounted, or?
No, those years.
Yeah, those are different patients.
Wow. How ironic.
It's interesting that it's the same number.
The same number, yeah.
It's actually not the same number if you look at what was reported. So it was reported to the CDC. The two numbers aren't identical. So I'm not sure why they're identical here, but if you look at what was officially reported, they're not.
Okay.
Okay. Thank you.
Let's move on.
Okay, so then here we are with So we wanted to give you a number of kind of total of what we're receiving in the lab, what we're processing, what we're working on, what follow-up, the caseload that follow-up has. So this is it's kind of a lot of different numbers, but we just wanted to give you an overall big picture of what we're doing. So this is the specimens that we have received at the lab, and this is in order of date received. So some of the information we'll show you is by birth date, and there's reasons why we show kind of the different way. One thing that I wanted to point out that these unsat screens that are listed here, these are specimens that were completely rejected. So we have a system up in the lab where the technicians will look at the card, and if they can only get 5 punches, they get 5 punches. So they don't have to reject the entire card. So we get what we can with what we're given. But sometimes we have to completely, a card is completely unable to be tested. So although these numbers look kind of small, there are other ones that we're following up on to get repeat screens because we couldn't test for the entire panel on that particular newborn screening card.
Okay.
So then, then you can see here that this is the total number of cards that we receive in the lab and process in 2018. It's quite a big number.
Yeah.
So that's total numbers. And then we have our confirmed cases. And these are by birth date. We wanted to keep these by birth date just to keep it each year the same. And they're again pretty similar from what you've seen before. 2018. And then we have the incidental findings, so those secondary. Then, so that brings us into 2019. So I have the same exact charts that I had for 2018. Pretty similar looking.
Hi, this is Dr. Richards. I have a quick question. So incidental findings are things that are carriers or partial and not complete disease. Is that what the definition of incidental findings is?
Correct.
Okay, thank you.
Okay, so this is our 2019 data.
So Wendy, what happened with the second unsat there in June and July?
Oh.
For 2019, do you know what it is? We had expired cards.
Oh.
Yep. So we had an overlap of sending out cards that were recent, and people just had a large supply of cards that were expired. So it took us a while to educate and saturate the market and tell them to throw out those cards that were expired. But that had a huge effect on us for sure.
Oh, yeah.
And then here are the confirmed cases for 2019.
So Wendy, I'm not seeing CCHD. Is that on this or is that on a different chart?
So CCHD, we don't actually do any of the follow-up on. So we do the initial screening. It is listed on the card. And then once it's listed on the card, it goes to our birth defects monitoring team. So we don't have any like straight numbers for that. And they're always working about 2 years behind for final diagnosis and things like that.
This is Diana, the manager of the Birth Defects program. So we are implementing processes with CCHD to do it more real time. We did a whole year-long project with Sonal and Wendy to improve kind of the quality issues that we found a couple years ago at this meeting with some of the issues with reporting. So we have some new processes and follow-up in place, and certainly at another time we'd be happy to share that data and kind of our new processes and our findings. Yeah, I think we're on to some really good things to be able to catch babies sooner and to improve the quality of the screenings that are done at facilities.
Thank you, Diana.
Thanks.
Absolutely. Thank you.
And then here we have our incidental findings. And again, all of this will be posted, so you'll be able to access it easier than trying to get that secure email. And then we wanted to show the totals that we have for 2020. We don't have confirmed cases just because we're still working on those. So we don't have final 2020 data, but this is just straight numbers. And then on the next slide, I will show you the comparison from year to year. So we can kind of look at volume. We wanted to show if there's been an impact. So if there were fewer babies screened because of COVID than in years past. So these are the numbers that we have compared to the live births. And it seems about similar from year to year. But we wanted to give you this information just so you could see that.
So total births are down is the point.
Yeah, pretty much. Yep.
Yeah.
If you go back up to the previous slide, I was looking at the second. I was sort of wondering what the percentages of second screens to first screens. And it looked to me just really roughly like about 500 babies different. But I was wondering if this year was different.
Are you talking from the 2019 or the screen that I'm on now?
The screen that you're on now
Okay.
is for 2020. And so I had looked a little bit more closely at 2018 and 2020. By the way, this is Olga. I'm a nurse representing community birth. So I was thinking about that follow-up with the second screen and what percentage of babies actually get their second blood spot. And then that made me wonder if 2020 was different. That's where I would expect to see a drop off.
Oh.
Pandemic wise, actually, people didn't want to come back for
Right.
things if they could help it.
Could it also be that they didn't want to get pregnant because of COVID? And then in 2021, we're going to see a lot of babies. As a pediatrician, we were hoping that we can be busier. Just curious.
Possibly.
Pent up demand.
Okay, so that was all of the data that we had. Again, it will be posted. I will send it in an email when we complete the meeting. Feel free to always email me any questions, or if anyone has any questions now, we can answer those. But if you wanted to dive more into it and then ask us later, that's perfectly acceptable as well.
Okay, let's move on. And I'm going to take the prerogative of moving actually to legislative updates, which is number 5 on the agenda, but it colors everything we want to say going forward. So I want to take this up. The first question, of course, is how many of you have been following what's going on in the state with respect to legislation? And where we stand now is we have a bill called Senate Bill 1680 before, I guess it's passed the Senate Health Committee and is going to go to the floor of the Senate. Do I have that correct? If anybody can correct me on that?
You're right.
Okay, so and after it finishes, if it gets through the Senate, then it will go on to the House, hopefully not terribly changed, because then they would have to have some reconciliation business. But this actually, when I first saw this bill, courtesy of Lilas and Melissa, I was really upset, and I think some of you will be upset as well. Have you all pulled the copy of the original bill? If you see, okay, there it is right here. What you see here, well, there's two things. It's a mixed bag. One thing is absolutely terrific, and the other is problematic. This whole red section is marking out our entire committee. In essence, the original bill called for no committee. And we're not sure why that happened. We think it's because the part of the bill that we really like, which was exactly our recommendation, called for the state to follow the RUSP recommendations in the way I'll outline in a second. And I think the person who wrote this bill thought, well, if that business is done automatically, the RUSP approvals, then we don't need a committee. Well, of course, the committee does other things besides just decides, talks about RUSP, but talks about other things. So that's the problem part. And I'm going to hold this for a moment because there's been some changes to this, which I'll go over in a minute. So let's go back to the previous page. I guess it's when do you have it? Yeah. Okay. You can see here in blue here that this bill has adopted the exact language that came from our last committee meeting, calling for the state to follow and implement the disorders that are recommended by the National RUSP Committee. And for those things that are already approved, there's a certain deadline. Unfortunately, I broke my glass this morning, so I'm having trouble seeing the writing here. But if it hasn't been approved, the state has 2 years from the time of approval by the RUSP Committee to implement it. So let's see if I can anybody read that for me? I'm sorry, my vision's gone out here. When does the currently recommended things have to be on by when? Let's take a look.
Well, the current reading says the newborn screening program should include all congenital disorders that are included in the RUSP by the Secretary of the United States Department of Health and Human Services for both core and secondary conditions beginning January 1st, 2022.
Okay, so that's what we haven't implemented. And what are those 4 disorders? They're spinal muscular atrophy, X-linked adrenal leukodystrophy, Pompe disease, and MPS 1, if I'm correct. So I think this was an absolute huge win that this language is in there now. Now, what is not clear is, let's say that this passes and it then passes the House and it becomes law. What will it take to implement it on the financial end? And I'm going to need some help on that. I assume the Rules Committee will follow in order and grant the economic changes that are necessary to adopt this. Does anybody have an idea how that's going to work? Kind of a tough question, right?
This is Brianne from March Adams. I'm happy to jump in and tell you from the financial standpoint of what I know. So JLBC must review the proposed fee. They don't have to approve it, but they must review it. The governor's regulatory committee must approve the fee increase. And then it's also written that any legislative intent specifies that the fees must specifically fund the newborn screening program itself. So this would allow us to take the fee out of statute, allow ADHS to determine what that fee is that they find appropriate and submit that to JLBC. So this allows it to be more nimble and puts it on the department to be able to establish the cost that best fits their needs.
Okay, so if you could boil that down for me, does that mean that with this language from the legislature, there is a requirement that the executive branch, the governor's office, et cetera, follow through and implement these irrespective of the fee?
Yes, so ADHS will need to provide that dollar amount to the governor's office on what they believe it will cost for them to successfully run all elements of the program. The money for adding the 2 conditions this year has been proposed in the governor's budget this year. So that money is there should the budget be approved as is.
so it doesn't include the other two though, and so that somebody would have to start hustling on that side to get the other two approved. Is that correct?
So it does not, the governor's budget does not include those other two conditions. This is putting it in the hands of the department to figure out internally what money they need to request in their budget. It's not something that we would have to go to the legislature and find. This would be asking the department to find out what that true cost is.
Okay. So boy, you can see where I think that this is absolutely tremendous. And all we know is it's passed the Senate Health Committee and is getting ready to go to the full Senate. And if it passes there, it will go to the House. But we don't know. We don't know anything. We don't know that we'll pass the Senate. People I've talked to said they think it will if it got through the Health Committee. It's likely to pass through the Senate. I don't know enough about the House, whether or not they rubber stamp or whether or not there'll be problems. I simply don't know. But so this to me is a major victory. But the second part is a little bit of a concern. The
Dr.
second
Alec?
part is, yes.
I'm going to interrupt for just a second. This is Monica Attridge with the Hojoni Foundation, mother of a child with cystic fibrosis. Brianne, if what happens if DHS doesn't have the money to pay for the new conditions to be added?
It would be the same as it is now. So we are just removing that dollar cap from statute, because if you ever wanted to go back and change the fee cap, you have to go to the legislature. So this is putting it more in the department's hands of they need to find out what the cost of the program is, and then they need to ask for that in their budget to the governor's office. We have in years past gone to help fight to retain fee costs in the budget, but this is actually less restrictive in being able to have ADHS set that true cost and be able to raise it as they need, only having to go through JLBC approval and not legislative approval.
So there is no requirement for them to somehow find the money. If the money's not available, the conditions wouldn't be added.
Are you speaking to just these conditions proposed, or are you speaking to the overall panel?
No, conditions proposed.
Yeah.
The conditions proposed. So in the proposed budget for the governor's 2022 budget, it is in there for the two conditions. Now for the following years to implement, ADHS needs to do the review and the cost estimate to decide what that would be to add those two tests, and then work within their leadership to put that in the overall ADHS budget request to the governor's office.
So I have a question, Brianna. Does this, the way I read it was that they still had to go through the rules process. Is that not the case? And if so, how are they going to get that done by 2022?
Rules process for adding the conditions?
For the fee. For the fee.
So by taking it out of statute has eliminated the need to have to go through rules as far as we look at it. Internally, how ADHS does that, I'm not sure. That would be their purview, but we are not requiring it. Again, that we did not write for a rulemaking exemption, which we could have, but we believe that the money that is in the proposed budget will help cover the costs for the added two conditions. I have spoke to Sonal about some of the struggles, opportunities, barriers to be able to make this happen. But again, I'm here as a resource to help, but AZDHS needs to put together what that cost is and then deliver that to leadership to add it to their proposed budget. So this is kind of something internal that ADHS will have to know. How much does it cost for them to buy the needed supplies, the machines, the follow-up staff? That true cost has to be proposed from within.
So hopefully your interpretation will be the same, will be followed by ADHS. ADHS will agree with your interpretation. Ward, do you have any comment on this at all? Ward?
Sorry, I was looking for the unmute button. No, I mean, this is sort of new for me in terms of how I'm learning the same as all of you are in terms of what this would look like. You know, if it passes, you know, I don't really know. It's something I'll have to ask our leadership. Like, how do they see it? I know we're all working right now on a budget for all of these disorders, so that's underway. But in terms of the mechanics of, you know, will it be rulemaking? Is there some other process? I just don't know yet, but I'll find out and get back with you all.
Okay, more questions for Brianne, or can we move on a little bit here?
This is Dr. Richards. I have one more question. So we've talked about the 4, but let's say 3 years from now, there are 2 new tests that come up or something that we have more information. How does that roll into the future of this bill? Does it mean that because RUSP says it should be done, it then goes to AZDHS, they say it'll cost us this, they submit it to the state, and it needs to go into the budget? I mean, what happens in the future after these other ones go through?
Presumably, we'll have to look at the language again, but presumably this covers future events. I guess I better look at that language again. I sort of assumed it covered all future events, but like I say, I don't have my glasses, so I can't read it. So
and I'm happy to jump in just while you're reviewing.
Yeah.
So we wrote this similar to other states have done this, as we call it, an auto add bill. Now, ADHS will be required to auto add the conditions that are adopted to the RUSP within 2 years.
Yeah, that's right.
So again, we really wanted to assist the department in having a nimble piece of legislation that allows them to pivot. We absolutely added the committee back in to the structure because you guys provide amazing value, and it's written in there that the committee is going to discuss emerging trends and be able to kind of be on top of things that may be coming down from the RUSP. So that is in there. ADHS was pretty straightforward about that they wanted this to be a nimble committee and not have to go through rules and oversight like they do some others that we have worked on that require certain seats on a committee that is monitored by the rules. This was extensively shopped and negotiated with between payers, providers. There's been a lot of people at the table. So this has kind of boiled down to priority being making sure that the tests get added and that some of the other language in there has been negotiated between parties at the table, which is kind of how we got to where we are. But again, it's really meant to be an auto add bill to support the conditions on the RUSP, not having to go every year back to the legislature as we've done in the past. Many of you have heard me before. I've had the pleasure to work with, and it's been kind of the sticky wicket for us is that the fee has been written in statute. So when we talk to ADHS and they say that, you know, costs have gone up for X test and the materials have gone up and they need more money, we have to go back to the legislature, do a bill, do the whole process to increase that fee. So again, this is kind of taking that piece out of it, and the department now can directly work with their leadership in the governor's office to determine what that cost is and if they need to raise it.
Again, a huge advance that you guys have put together at March of Dimes. Huge advance. This is exactly what we wanted. You never know exactly how it'll run through. You know, I didn't know the nuances of that. This will fall on ADHS and they'll have to get monies to do this. And I don't know what that means for ADHS, but this is what we want. But let's get on to the second piece here. Now, we look at that second page there with the red out. Wendy? Yeah. Okay. So what this has in it, it has the committee and all its constituents. And there are 15 people on the committee, and of course, this language wipes it out. Now, I've seen another amendment, and Brianne's probably going to speak to that. But what I think the language of that amendment is, and you'll correct me if I'm wrong, Brianne, is the new committee would consist of parents of children with the disorders that we uncover, audiologists, physician specialists, people from
Kirk.
the Part C, I guess
Kirk. Kirk,
Yes.
this is Lilas, and that's what we propose. That is not what the amendment currently says. The current amendment that passed through committee that DHS has agreed to is only that they would put the new committee in, and that's all. They don't list any representation. They don't list any responsibilities. They don't list any anything other than that they shall establish a committee to make recommendations and advice. So all of the people that were represented, their voices are not listed here anymore at all in what is current.
Right. So this falls to the director, but Brianne, I think you said something about this a few moments ago. Maybe you could clarify a little bit on this language.
Sure. So this was brought to our attention again by DHS and team that this is meant to be more nimble and allow for more participation on the committee, to take out the need for really that rules oversight of making sure that you have quorum and you have all these other pieces that are required by listing those people in statute and listing what they must do. So it's my hope that, and the amazing people that I work with at the department will continue to do the work that they do in the best interests of moms, babies, families, everyone, by having the seats at the table that they know they need to hear from. So this really can allow them to expand it. It can allow them to have more flexibility as to what the committee's goals may be. It doesn't have to have, reporting out of public minutes. It doesn't have to, it's taking that government oversight out of the specific language and putting it into the hands of those that are expert in the program. So we're viewing this as a positive. I know Ward, I know Wendy, I know Sonal. I have every belief that their intent is to provide the best program that they can. And I see them making this change and being even more successful by having more voices at the table. It may allow them to even have multiple committees. I think the possibilities are endless. And that also allows them to work into their fee request a cost to maybe host different committees. So it is giving program the opportunity to run program when they are the experts in it.
So how would that work? It sounds like the committee exists, and the whole thing is always, the committee is always appointed by the director. So presumably the director will be making these determinations. I mean, if the committee doesn't have a solid sort of who's on it, who lobbies, who talks to the director to say who should be on it, et cetera, how does she get that advocacy, that advice?
My guess, just from how I've seen different bills roll out internally, is Dr. Chris will appoint an appointee to serve in her position. I'm guessing she'll tap potentially Ward or someone as the designee to decide on who needs to be on that committee. So she will be ultimately responsible for the committee happening, but she will delegate that out to the program staff. So that person that she is saying, I entrust you to fill this requirement and report back to me, will probably be a program person who, again, I believe represents the interest of everybody and is also advocating just alongside you guys. So I don't see it just as the director making these decisions. The director will appoint a designee, and they will be able to really guide her into the program aspect of it.
Dr. Alec, I have a question.
Go ahead.
This is Monica. Brianne, do you represent the department or March of Dimes?
I represent March of Dimes. I work closely with the department to make this bill something that not only aligns with March of Dimes priority, but works within ADHS. We've shopped this through Access, we've shopped this through the private payers. So everybody has kind of come to the table to agree on to this. So yes, ADHS is the administrator of it, but they have also blessed this bill.
But this is sounding a little like criticism, so don't take it too seriously, but you didn't shop it through this committee.
In my defense, really, I think that ADHS should have shopped it through the committee, not program, but internal counsel as their government affairs. But I'm happy to take the heat for that. And maybe ADHS wants to have their internal government liaison come and present as well. But that person has been very much involved with the crafting of this bill.
And who is that?
I would probably defer you to talk to Ward or staff there, but they can connect you with Rick Hazelton, who is the ADHS legislative liaison.
So I also have to point out, Kirk and Brianne, that the other groups that weren't included were the parents of children who are affected by these, the adults that are affected by these disorders, the providers, including the audiologists and people like Dr. Kirk with genetics, and the other medical specialists weren't involved. Ear Foundation, who's been involved with every piece of legislation for the last 25 years, wasn't involved in this. So I think a number of core stakeholders that are actually really close, and the people that are actually impacted by some of the policies and that were excluded from the process as well. And so there's concern with me that the vague language of this really doesn't translate into accountability and transparency as far as what will happen moving forward with the data, with the members of the team. What is that going to look like, and how is that going to work? Because I think that transparency and accountability is already questionable, and so I'm concerned that this is just going to make that worse.
Sure, and I hear your concerns. I can validate some of that as well. I want everybody in the community to have the opportunity to see this bill and provide feedback, not only through me, but through the organizations they represent. That's the public due process. So I encourage everybody to look at it and do that with your personal representatives through your organizations and be involved in this process. That's really what it's meant to be. I don't want it to ever come out as this was passed without anybody knowing. So, I want to serve as that liaison to the best of my ability as well. That doesn't mean that something future cannot be run specifically to more of those concerns. We really approach this as, what do we have to do to become an auto-ad state and put the conditions first, because that has really been a holdup in a number of years, as you know better than I, on the struggles that we have had to increase the fee, and that's dependent on legislature voting if they agree or don't agree in raising a fee. So that was our number one goal, was to be able to get that out of statute and start testing for the conditions on the rest. That doesn't mean that we are done with the improvements there. We just saw a gap that we thought this year was a right best year with the legislature, the way that it's seated currently, the governor that we have, to get something like this through. So we wanted to capitalize on that opportunity.
I think that's a great point, that we want to capitalize on that opportunity, and the fact that it's open right now means we may want to look at it further and offer amendments. Kirk, one of the things I want to talk to you about is are you able to see when people are raising their hand, or do you want me to point that out for you?
No, I can only see 1, 2, 3, 4, 5, 6. I can only see 7 persons.
Okay.
I don't know how to get more on there.
Dr. Paulus has raised her hand, and Lori Sang has raised her hand. So, and I think Monica dropped hers. So it's just Lori and Dr. Paulus.
Lori, you want to go first?
Hi, yes, thank you for letting me speak. My name is Lori Sang, and I'm a parent of a child who is deaf. And I just wanted to bring my concerns to taking the stakeholders out of this is big. There's no one that represents and is invested in this as the parents. We're the ones that are having to deal with the kids and their needs. And so taking them out of being able to have a voice in this is detrimental to the entire deaf and hard of hearing community. And we want the accountability and the transparency of the department. So we really feel that we should have a voice and we should be included in this. And so taking that right out of here is something that is a huge concern to us parents.
And thank you for saying that. I think that was absolutely not the intent of it. I do believe that it actually could expand on the way that parents are involved in the current process. Again, that's not to say that we couldn't add language around something that is less restrictive, as naming the seats on the committee and the number of people, requiring, requiring quorum and things like that that we're trying to remove as far as that government process. But I don't know that we can't propose a simple amendment to the bill sponsor that says establishing a committee comprised of both clinical and community and parent lived experience experts to provide the department with best practices and emerging trends. It's not saying that we can't add that. I think what their big pushback is the listing of the 15 seats and that then requiring those names to be submitted officially to meet rule and taking that kind of administrative burden off the program and allowing the program really to focus more on meeting the needs of families and stakeholders and not necessarily typing up minutes and making sure that committee seats are filled and submitting CVs. And so I think that there is room to make everybody at least a little bit happier in the process without getting too restrictive. So I hear you in saying that parent voices and lived experiences is important. I absolutely agree. And that's something I can take back to the table and ask if we could make that slight tweak by adding that specific description to the amendment. But I do not see them adding back listing the individual required seats and again, that rule process.
This is Lori again, and I agree with that. But the fact that we were totally removed from that, I think there should be something that says parents are allowed and do have a seat. And you don't have to be descriptive, like you said, to list those 15 parties that were on there, but something in there that guarantees that parents will have a voice in this.
And I can agree with that. And I'm happy to work with anybody offline on maybe crafting some simple language that we can propose as a House amendment that would include, you know, just the making sure that the voices of the parents are included. Again, I think it can be simple and doesn't have to be overly burdensome to make sure that that piece is communicated. But again, kind of the intent was when people in the governor's office or other go through the public committees, which are all listed, and so this is a public committee, and see open seats, it can bring into question how well those programs are being run and monitored. So we want to be able just to remove that, again, administrative burden, allow for more participation, allow for the department and program to do what they do and get creative. And maybe they want to have a full-on just parent group that comes together to talk about experiences of how, you know, they've worked with receiving diagnosis, timelines, being able to connect within the community. You know, I think that it allows for the department to dream as big as they want. And we hope that parents such as yourself will keep pushing in that direction and come up with those ideas on what gaps are currently not being served.
So well, let me let Leslie speak first. Dr. Paulus.
Hi, can you hear me?
Yeah.
Oh, good. So I first heard about this bill at a meeting on Monday where our legislative liaison at United Healthcare was telling how pleased that they were that it passed. And I thought, I'm on the committee and I hadn't heard about it from the committee folks. So that I similarly was like a little bit shocked that we had not been included. But that being said, here's my next question. What makes this new designated committee that doesn't have the constraints any different than the partners meeting that's happening currently? So I just have a little bit of concern that the roles have kind of switched to a more, oh, well, we'll just invite whoever can come and a few people and we hope they come, but it doesn't have the same sort of intensity and purpose, perhaps, that goes along with actually being legislatively assigned. So that's my only concern. I mean, I'm all for trusting and you know, getting more voices and having the committee be nimble. But what are the exchanges? So that's my only thought.
So Leslie, I just have to point out that there are no parents in the partners meeting.
Is that because they don't know about it and don't come?
They haven't been invited that I know of.
There were times where folks used to sit in the back on the side of the actual partner committee. So either way, parents, so you're saying that that has been designated legislatively as well, and there's they do not have parent voice,
No, that's
or is
not
this a DHS?
It's not legislative. The partners meeting is just a department choice.
It's ad hoc.
So then that's even more of a concern that it wasn't open, or there weren't notices for families. So anyway, how do we know that it wouldn't, evolve to something like that if department hadn't even done, a partners meeting that was open to the public?
Well, we clearly need to have some language that as I'm hearing this, the ADHS administrator would operate with, that would give it some structure and designate certain people that have to be on this committee from certain areas. I do agree that, we don't want to make it so difficult, so bureaucratic that we can't have votes, et cetera, et cetera. But on the other hand, right now it's too amorphous for my taste. And
correct me if I'm wrong, but the partners meeting is not in statute. That is something that program has implemented because of their best practice. That is not in statute. So it would not be something that falls to the public law requirements of posting your minutes, posting calls to order. That's something that program does internally. So we wouldn't address that. But I would encourage anybody to take that up with the director, with program staff, to say that this is important and you want to see this expanded on, continued, whatever that is. But currently that is not in statute anywhere.
Well, this is Diana from the Birth Defects program. So coming from somebody who's not part of this legislation or program, but a similar system, we're all still accountable to our stakeholders and our patients. So again, going with like the best practices of the partners meeting, the flexibility in the rules really generally helps the programs morph into what's needed over time without that legislation burden. So less is more with rules very often, and they're still accountable to the families they serve. Yes, when it's in law, it's great, but they've been doing the right thing for a long time. So part of it, we just have to continue to maintain those relationships, and parents and advocates speak up, and they can't just ignore the public. We all have stakeholders, we all have partners, and I think flexing the rules a little bit to allow for things to change as needed is a positive.
But we need some minimal language, and you alluded to this earlier, Brianne. Some minimal language. You would like to have a subgroup meet to put some minimal language in here that represents some sectors. I think that's real important.
And I think you should keep it as simple as saying, providers, parents, and community. I don't think that you should go any more specific than that. That's my opinion on the bill. Again, work within your organizations that you represent and come up with what they feel is best and most important. And, we can discuss that. But from my standpoint, I would keep it to listing those categories, but not putting restrictive number of seats or specific titles on them.
What happened to Part C? What happened to Part C?
Part C.
What happened to, you didn't say anything about representation from Part C. I mean, that's been part of the committee.
I don't think I know what you are referencing as far as Part
C. What is Part C? Is that access? What is Part C, Ward?
AZIP.
AZIP. It's AZIP. Okay. For instance, AZIP. I just want to make sure we don't have a major contributor that's the language isn't in there. And what about I think isn't access is in this committee? Would it continue as well?
Yes, Kurt, but as a state agency, we have to take a neutral position on the bill. So I'm not really in a position to make specific comments on how the bill is crafted.
Okay. Well, I think we need a little subcommittee here to put together some language that's that's inclusive without being overly burdensome. And I think we have the rough outlines for it right now. But it's going to be very incumbent on the administrator from ADHS to make sure all the voices out there that need to be represented get represented. For instance, I mean, parents and subspecialists, extremely important. Not to, the audiologists. They all need a voice here.
And I absolutely agree. And I think that's where the community has to hold the department accountable. Again, with the less is more comment of when you start to be very specific and name certain people in statute, if that organization changes name, if that organization merges with another group, if another one comes up that is new and emerging and is doing great things with an amazing amount of funding, you're restricted on if they can or cannot be involved based on the language of who has been appointed in the bill. So that's some of the background about why we want to kind of remove those very specific titles and organizations. But again, having worked in public health and knowing the public health people who do this work, their intent is the best of intent. And their door is always open to the public to say, what you see is needing to be filled, and you should be doing that and making those recommendations to the department and leadership. And I think very much the good work is being done, but we now have the opportunity to push for expansion. And if that's something that parents feel is important to have a specific parent committee that meets to provide, X recommendations, then they can. It's just really kind of opening it up for the creativity of not only program who is the experts in it, but also the community to say what that need is.
Kirk, you have a number of people who have got their hand raised, including
Okay,
Moira.
and I can't see the hands. I don't know.
Yeah, it's Moira, Leslie.
Do you want to run that? You want to see
Sure.
the hands and call them?
Sure. Why don't we go ahead, and I think Moira was the next person to talk. Why don't you go ahead, Moira?
Okay, so a simple question I have. So is it possible if this new committee has its own internal guidance on its members that are not formally part of the statute? Meaning it does not have to go through all the rules and get all the CVs and everything, but as an internal guidance, we should have members of these groups. Is that something that's possible that makes it less restrictive?
Yes, and without actually being employed by ADHS or another state agency, they absolutely have the ability within program to designate what the deliverables are for each program within their state dashboard and metrics. And each person has a job description and what that is and overseeing X committees. So absolutely, that's something the department can create and monitor and have an expectation of without it actually being trackable in a statute.
So
Next person
you've been awful quiet. I'm sorry. Let's let the questions be asked first.
Yeah, we have Olga, and then Monica, then Dr. Gonzalez, and then Dr. Paulus. So Olga, if you want to talk next.
Hi. So I wanted to say thank you to Brianne and whoever else helped work on this language. I think it sounds very smart. I think it sounds like it'll be much more efficient to take this out of statute to allow the Department of Health to really exercise its authority. I think I represent a minority that community birth represents probably less than 5% of the births in Arizona. And the fact that I'm here on this committee is because somebody in the department felt that it would be a good perspective, not because it was in the statute. So I think that there's good hope that the department would continue to look for that kind of diversity and perspective. I also think that this, as Brianne said, actually gives us an opening. I sort of feel like we've been spinning our wheels the little bit of time that I've been on the committee. We've been sort of aggravated that the screening that we recommended hasn't been put into place because of budget problems. And this will allow us to just let the RUSP stand, but maybe focus on some of the things that our diverse representation can help us do successfully in the state. I think there's lots of things that we can do successfully, and this language would really help us do that. So I appreciate Brianne and whoever else helped work on this. I think it's helpful.
Thank
Well,
you.
I appreciate you, Olga, and respect you and all that you do for the community. And I absolutely agree that this is something that, you know, again, I encourage everybody to propose. You know, this group that they put together can have subcommittees, they can create goals, and say one of them is to explore how to promote newborn screening within community birth. That can be something that they choose to focus on. Again, it's just not directly in statute as something that then is a reportable metrics and, you know, then requires public open meeting. So I'm hopeful that this then empowers all of you all to think creatively and get your constituents involved and allows program a little bit more room to flex their muscles and creativity as well.
So Monica, you want to go next?
Sure. My concern about taking out the statutory requirements for the committee is that the committee will no longer have any parents on it. Just Brianne, your comments about, you know, make suggestions about talking to other parents. These parents that have children that are involved, that have a disease that was identified through newborn screening, they're experts in their field. And so I feel like those kind of suggestions marginalize them. And I really feel that very strongly that this committee has got to include parents. If parents aren't the customers of this program, who is? So,
and hopefully nothing I said was taken in an offensive manner. It was not intended to be that way. I am a huge parent advocate and believe in the lived voices, and I try and do that across many of the programs that I work in. So I absolutely hear you. I validate that same concern. I agree parents need to be a part of this. And I think by listing, you know, a lived experience and a parent in the generalities of the bill that allows and encourages that. And then also, you know, speaking a little bit more on the personal side, then it allows the parents to hold the department accountable to what they think their best practice recommendations are. Like, as a parent of a child who has a condition caught on newborn screening, then you really want to drive the department to meet needs that you are not seeing that are met. That may not have been identified in a bill that was crafted 5 years ago. And because of that restrictive language, they're not allowed to do that. So I hear you. I agree that parents have a voice in this, need to have a voice in this. We just want to be less restrictive as to saying the number of parents that have to represent organizations or of X conditions, or how many times they need to meet, or having public rule followed. So all of that, I absolutely agree. And I think that's why the state also has other programs like birth defects monitoring program, Raising Special Kids, that really also helps amplify the parent voice. But I hear you, as they are very important to this process, as well as the umbrella agencies that also are supporting those parents.
And I guess I don't oh, sorry.
I'm sorry, who was that?
It was still Monica.
Go ahead. Yeah, go ahead.
I again am a little bit surprised that March of Dimes is on the side of advocating for not including parents of kids that are identified through. What am I missing here?
I didn't hear that, Monica.
That's not what they're saying.
Okay.
They disbanded the entire committee. That include the physicians, that include the audiologists, included everybody. Now we're trying to put Humpty Dumpty back together again the right way.
And that's fine. Just please make sure that you include parents.
Okay, we've got a couple more people that would like to speak. Next would be Dr. Gonzalez, and then Debbie Johnston.
Yeah, I can take over from here. I got the message now.
Oh, you got it? Okay, great.
Yeah, go ahead. Go ahead, Arturo.
All right, so I'm not a lawyer by any means, and I've been listening to all the comments. And at first, I was also upset as to what the bill stated. But the more I think about it, I think leaving it more open, you know, without being so restrictive and putting names on the bill, may be to our benefit. So if we were to put something like a designated committee, like they said, and add to that, and the committee has the authority or power or whoever is the wording to have appropriate representation, that the committee may make decisions to do so. That makes it very generic. Excuse me, I mean, anybody else can reword that, but you get what I'm getting at.
Yeah.
So is there's broad representation that is decided by the committee and not the legislators. That way, if we need, parents are included, all of us are included, everybody's included. And then if we need somebody else to be included, we can add to that committee without needing appropriate or a bill or something to amend the bill if we needed to add another person. That's just my 2 cents.
Yeah. Yes, Debbie?
Yeah, I was just going to add in from a statutory construction perspective, it did make sense to eliminate the committee and the underlying bill, because if you look at what the original charge of this committee is, it is tied to making recommendations on the test to be added. Since the bill's going to the RUSP panel, you know, the original purpose of this committee is not really necessary, but I think as the amendment, the amendment is very appropriate because it reconstructs this committee with a lot more flexibility to do things beyond, recommending tests to be added. So I do kind of like the idea that it's flexible, but I think all stakeholders, as Brianna and others have said, really need to be giving the department ideas on what you want the committee to focus on and who should be at the table.
And thank you, Debbie, for that comment. And I encourage the committee to research what other states are doing as far as how they're running their committees and their internal programs. And again, we've looked at statutes in other states and have chose to make it less restrictive as they have to allow for other opportunities. But there are other states doing quality improvement projects. There are states doing, public education campaigns and things that maybe came out of a creative effort that would have been made it more difficult if it was more descriptive in statute.
I don't understand, Debbie, how do you read this, that the purpose of this committee is only to recommend disorders? How do you read that?
If you look at what's stricken on page 2, that the lead in on what's subsection G, it talks about the director establishing a committee to provide recommendations and advice to the department at least annually regarding tests that the committee believes should be included in the newborn screening program. Any recommendations by the committee that a test be added shall be accompanied by a cost-benefit analysis. So it really is focused on tests to be added. There's not even though there's nothing that prohibits the committee from going beyond this. That really is the charge of the committee.
Yeah, so what you're saying is then getting rid of the committee completely is consistent. If you define we got some background noise here. It's consistent with, if you strike that all, then it leaves you back with that position that it's only to suggest things. But there's so much more involved in advocacy for a newborn screening program, even to see how the thing is functioning. How is it functioning?
Absolutely, I agree with that, and that's where I think adding back a committee that is more flexible and can focus on, really looking at the data. I sit on the State Trauma Advisory Board as well, and we look at trauma data all the time to look at performance improvement and how we can be doing better. So I think that's something that this committee could really be, or this new committee could be focused on, is really looking at data and then looking at best practices. There's all sorts of things that could be that this committee can focus on now that the RUSP panel is part of statute.
I think one of my concerns, this is Lilas, is that the department's never been prohibited from having these other committees or work groups or whatever, but they haven't had them. And so what makes us think, if you remove the requirement, that they're actually going to have them? And I think that it's important that you have systems in place. And so, yes, I absolutely agree. You want to loosen up the restrictions on them so that they aren't hampered by, too much. Having the fee and statute was a horrible idea. And we argued against it in 2005. But I think that having some systems in place so that it's not dependent on the whim of a department that may or may not want input, particularly parent input. I think that it's important that we have some structure in there that supports that, because it's that hoping just doesn't do it for me.
Okay, Moira, you're on up again?
I think it just goes to whoever committee is put on the committee to add the wording. We have to be strong that it has certain representation, but it doesn't have to say who or how many or how long, and that what the purpose of the committee is. I mean, right here in what we have in blue text, it talks about newborn screening best practices and emerging trends. For instance, we just reviewed the newborn screens, and in how 2 months we had a bunch that were unsatisfactory, and we learned that it was because of expired cards. So could we go forward? And one of the things that this committee would be working on is looking at quality. What are those things that make those quality fall away? And is it the committee that can work on saying, these are the things we need to make sure are getting done? Or when we look at the congenital heart disease screening, are we following that like we need to? Does there need to be more representation? But again, if that is less restrictive, as Brianna is saying, there's more flexibility what gets done, but there should be definitely a description of the groups of people. And Monica, I don't think any of us would ever consider not having parents. It's just abhorrent to my mindset to think that. And I think this committee is very much under that, especially because of who's involved. I mean, we've got pediatricians, we've got delivery providers, we've got neonatologists, we've got those people that work with families. That is who we provide our services for. And I just think I couldn't fathom not having parents on the committee. I have to tell you that, Monica, it wouldn't mean anything to me, really, to not have parents on the committee, because that's what this is all for.
Leslie, are you up again? No?
I'm on,
okay.
on mute, double mute, sorry. So I was just thinking about the community partners, and I was thinking about this new structured committee that we're talking about, and wondered about what would happen if you put the two together, or does the community partners, may not be named right, but if, because I consider parents partners in this type of venture, but it does have a kind of more of a professional and focus, but it doesn't have parent input, and so we're always trying to figure out what parents do, what they need, and how does this verbiage sound to the parent, and we don't have their voice. So what if it was a combined committee? Just a thought. It might be too big, and you might lose the flavor of the partners. But I'm just a little concerned that after it was pointed out that we really don't, in the community partners, have any family input. That's so important, no matter what you're doing and saying, and considering for best practices, not just technical best practice.
Well, the partners operate, they're much more, how to explain it? It's much more nitty gritty in terms of getting what's going on within each individual specialty. I think they're very separate functions, but I agree that the constituency should be similar. But we've already specified that we're going to have parents on this committee. I think your question should be, why don't we have parents on the partners committee? I mean, that's what it seems like this boils down to. I almost have the feeling you'd like to combine these committees in some way. Am I hearing that?
Doctor, this is Monica, and I have been invited to partners committees.
Oh, okay. All right. All right, Debbie, I see your hands up. Did you want to talk again, or is that an error?
Nope, I did not raise it.
Okay, Ward, you're up. Ward?
Thanks. Thank you, sorry. Yeah, from my perspective in the partners meetings, when I recall taking over, It was sort of described to me as more of a forum for generally for people we had under contract supporting the program. And I think when I think about it, I mean, I know we've invited parents on an ad hoc basis occasionally for certain topics, but I thought generally, and correct me if you think this is if you think I'm off on this, Sonal, that we could go into details within that group, since they were all these people are under contract. They had signed business associate agreements, so I think we felt comfortable going into detail maybe about a specific case. Whereas if it was somebody who hadn't signed, all the paperwork to protect public health information, we might feel a little hesitant to get into, as you said, that nitty gritty about maybe specific cases as much. That's all I was thinking.
Okay. Well,
and I don't want to go down too far of a rabbit hole, but the way that this initially was written years ago is an interesting standpoint. And because you guys haven't really seen or were a part of the drafting of it, is because a committee that ADHS puts together and meets in their facilities and is run by their staff is not allowed to work within legislation and crafting. So it is a different dynamic than we see with other bills, in that usually it's an outside organization, an outside coalition that is doing that, crafting that, and coming back to them and saying, this is what we want. So it's interesting that they have had this committee all this time, but really can't encourage any of that type of work to be done. Just from kind of an outsider's perspective. Again, like Dr. Tack said, they're not allowed to promote or craft legislation, work on testimony, any of that. So usually that's always done by an outside entity. So it's kind of a different situation that this committee has been embedded in a program that doesn't have that authority or ability to do.
I think the order of business right now is to put together a subcommittee to work on this language, and it has to be done right away. Do we have any idea what the schedule is to go before the full Senate? It doesn't sound like we're going to intervene at that point. It sounds like we have to intervene at the House point and then have a reconciliation. Is that a good reading, Brianne?
Yeah, from my best guess, it's going to go before Committee of the Whole, or COW as we call it, either this week or early next week, and it will cross over to the House. And again, I think as stakeholders, you don't want to come off as opposed to the bill and have people turn out against it, because a lot of members get a lot of emails, they hear from a lot of people, and you don't want them to think that you're against newborn screening or against adding tests, or you want to be mindful of how you approach improving the proposed legislation. So I just say that to the group as to absolutely make your voice heard, have your organizations be a part of it, but make sure that it's short, sweet, and concise, that you do in fact support expanding newborn screening and do in fact support quality improvements and emerging trends. You can absolutely suggest comments and changes that you have, but make sure that you are coming off not with the intent that this isn't a good idea and to shut it down, because like I said, they get a lot of emails and we want them to make sure what they're seeing is that, yes, we support this concept, but there may be tweaks and changes along the way.
Yeah, the fact is, Brianne and her group have done tremendous work getting this language into the bill and getting it past one part of the Senate. I mean, this is a huge victory, and we don't want to take any chance that we're going to lose that by getting cantankerous with somebody. But on the other hand, we do have the responsibility to put a positive recommendation forward to change this, to tweak it, to make it just a little bit better. Okay, so I think the action we need now is to talk about who's going to be on the committee.
This is Debbie. Can I ask a question before we do that? Is that within the purview of this committee to be able to do that? I sit on a lot of DHS committees, and normally, especially for statutory ones, you're not allowed to do that. So I guess this is a question for DHS staff, whether that is, as a formal motion, whether or not this committee can take that action.
Well, let me just say something. Yeah, you're right. We can't advocate directly in that way, but we can certainly channel it through somebody like Brianne, or or as individual persons move forward with it.
I guess that would be my recommendation is either if any members of the committee have ideas in terms of what they would like to see in an amendment, to either send it to Brianne or you can send it to me as well. We have a lobbyist who's, I think, been working with Brianne's group on some of the language. I have not been involved in the bill directly, but I know he has. And I'm sure, and I'd be happy to direct him to work with Brianne on any changes.
Well, then maybe we just need to huddle with Brianne, who's not part of this committee, and sort of channel our concerns to her, so she can present it in the way we think's most appropriate. That's legitimate, isn't it? Because we're not acting as committee members. Now I get it. Now we're not acting as committee members. We have to do this as individuals. That's probably correct. Am I correct, Ward? We have to do this as individuals.
Yes, I just tried to send a message to everyone. Yeah, I agree with Debbie's perspective on that.
Yeah. Well, in a kind of way we're being muzzled, in a kind of way I understand the way this thing works. But we do need to back channel, if that's what it is, to Brianne to get the best language into this bill.
And I'm happy to meet with folks. I'm happy to coordinate a Zoom call. Again, kind of how I alluded to, it is that weird situation that the department has this committee and you want to make these recommendations, but the department is hindered in doing that because they can't put forth, legislative recommendations. So that's why it kind of falls usually to an outside organization who kind of does that advocacy. And that may be something that as a group you recommend that a coalition be established outside of this committee to advocate for newborn screening and bring awareness. And that's absolutely something that the group could find consensus in.
And we could be members of that coalition and this group at the same time, presumably. If we're not speaking for the group, we're speaking for our individual constituencies.
Correct. So
one of the problems is there's not much time. How much time do we have to put this together?
We have at least a couple weeks, probably 3 to 4 weeks. Again, it really shouldn't be too involved in needing that much time. I'm thinking it's really a sentence or two that we tweak in there. But we have a couple weeks for it it will make it through Cal as is. They can't amend it at this point. But when we go over to the House, those are the discussions that we absolutely can have. And we have a great bill sponsor who's willing to hear those changes. And it does have to go back to the Senate again once it goes to the House. So there's just still opportunity for that original bill sponsor to make sure the intent that they had for the bill is achieved.
Well, then I'm going to, as an individual, put together the language I think is appropriate, and I would encourage other people to do the same, and then you can distill it down. But I guess it's not fair to ask you to come back to me as a chair. No, you have to come back to me as an individual and tell me what the final language is.
Right, because where we're in that different situation again is like a chair representing this committee can't put forth a document that says we, the committee, feel that these are the language because it is run by the Department of Health. So you as an individual, you as an organization can, but right now there is no coalition group that advocates for newborn screening. It's fallen on, I would say, March of Dimes. It's fallen on Lilas's group. It's fallen on other individual organizations to kind of rally those groups. And while the department they have very specific guidelines they have to stick within that the committees can't take on and make these kind of recommendations around policy. So I hate to do this, but I have to jump. I am 23 minutes late for another meeting, but
how can I reach you?
Wendy has my contact information. I can chat in my email right here really quick.
That would be good.
And the Ear Foundation is happy. As we said, we've been working on the legislation since, 2005 or before. So, we are happy to bring together some of the stakeholders and those that didn't get a voice in the previous group and make suggestions as well.
Yeah.
So I hope I've answered everybody's questions. I hope everybody is maybe a little less angry coming into what we were talking about. Really, we do have the best of intent of representing everybody. It's quite hard to make everyone happy, as everybody knows, and especially when you're talking about dollar amounts and fee increases and all that such. So I value you guys. Thank you for your opinions. Please reach out to me. I chatted in my email. Ward and Wendy have it. If there's anything else, you can give me a call, send me an email. I'm happy to work with you as the folks that really are those lived experience best advocates and make your voice heard.
Thank you. Thank you for everything you've done, Brianne. This is a tremendous advance. We don't want to diminish what you've done in any way.
Well, I appreciate it, and we'll take all the support from the committee and your groups, and also, you know, your recommendations on what you hope to see in the language that is part of this due process that I want to make sure everybody has a part to play.
All right. Thank you.
All right. Thank you guys so much.
Okay. So Brianne's gone, but the topic is still open. I think, you know, this has been a really good discussion of you know, sort of honing down what we really want. And it's fairly clear that a lot of members of the committee really agree that it was overly burdensome. But on the other hand, we can't have it totally amorphous. So we need to provide some structure that's not burdensome, and that's the goal now for us passing something on to Wendy. And Moira, you asked who is the original sponsor of the bill. It is the March of Dimes. Am I correct, everybody?
The senator that sponsored it is Senator Pace.
Oh, okay, that's true.
Thank you. That's what I wanted to know.
But the language comes from, I mean, who wrote the bill? Let's ask that question. Well, we don't know who wrote the bill.
I believe it was March of Dimes. The two lobbyist groups that have been most involved has been March of Dimes and the pharmaceutical lobby group, Stuart Goodman, those guys.
Yeah. Obviously, the pharmaceutical community has a big interest in getting stuff in front of the newborn screen because they got products to treat these disorders. But that doesn't diminish the fact that 2/3 of the states have passed these things, and Arizona is beginning to fall behind. So I don't think it's legitimate what they're doing, and they're working through the right people. Okay, do we have more discussion on this topic? It just seems to me we've synthesized it down to the point to improve it. What we have to do, we have to channel ourselves to Brianne. I mean, it's kind of an odd thing, but that's what we have now. I mean, we didn't even know anything about this 3 weeks ago. But I guess I should take some blame for that, for not being more diligent about what this is going on in the state. Okay, let's go back to our agenda. Unless anybody would like to continue on this topic, which I'm very willing to do. Okay, let's go back to our agenda. Okay, so if we go to committee business, committee vacancies. Well, committee vacancies is a moot point now because we don't know what positions there are, what the committee looks like. So I think we can not have to deal with that. Candidate disorder updates, item 3. I looked on the RUSP website today, and it's exactly as we said. There are no new things that have been approved while we weren't looking. New nominations. There's a lot of people are proposing things. If you go to the RUSP website, you'll see which things have been suggested and turned down. I didn't see in my looking today of those things that are under active discussion. Does anybody have any information on this? Maybe there's an area of the RUSP website I couldn't find. But the question is, what are they wrestling with now? What disorders are now big candidates? And I don't know the answer to that question. Okay, so I think closer reading of that's going to be necessary. I don't know that there's one of the item here is current nominations update. I simply don't know what the status, what new things are being recommended, and what their status is. The RUSP hasn't. Their full meeting schedule is there. They meet 4 times a year. They met on the 12th of this year. They'll meet again in 3 months. So they're obviously doing things, but I don't have the insight on that. All right. Gosh, I think that actually does cover the agenda because we did the Office of Newborn Screening Data. We did the legislative updates. I guess unless somebody has some other comments about what we've talked about this far, I think it's appropriate to have a call to the public if there is if there's public representation right now in this meeting. I think, is there anybody advocates for the community that are not on the committee that are present and would like to say something? I guess not. All right. I think that's it. Ward, anything you have to add here? Anything at all?
No, I don't have anything at this point. Thank you.
Would you like to entertain a motion to dismiss?
To adjourn, I hope.
To adjourn.
Yeah. Well, I think just a quick question here before we do that. How many people in this room knew that this law was being proposed and what it consisted of? If you could just raise your hand, I'd just be interested in seeing how much in the dark many of us were.
Well, how long ago? Because like I said, I found out about it this week, but.
No. Let's say 1 month ago. Anybody knew anything about this 1 month ago?
No.
No, yeah.
I knew about this. Kirk, because we have a legislative liaison at the agency, and we have to analyze every bill, not just from a financial impact, but from other impact as well. So I was aware of this bill for some time.
And did Access have input? Did Access have input?
To my knowledge, no. Again, we can't help craft legislation.
That's right.
Okay.
You told me that.
We take a neutral position, but any pending legislation that may directly and or indirectly affect the agency and the program, we have to analyze because we may be called upon to give testimony while it's going through committee or it's going through one of the chambers, et cetera. So we have to analyze it from all aspects. So
Gotcha.
we don't craft the legislation, but we may be asked to testify. And Brianne has already alluded to the fact that JLBC will have a final say in the financial part of this, and we are always there to give testimony at JLBC for the impact on the Medicaid program.
What is that? Is that Joint Omnibus Budget Committee? Is that what JLBC is?
That's the Joint Legislative Budget Committee, yes.
JLBC, okay.
Yeah. And Kirk, I have to admit that I've known about it for a month or so, but we heard about it through one of the other organizations, the Arizona Speech, Language, and Hearing Association. And that was one of the bills that they knew about, and they contacted, actually, Stuart Goodman contacted us with some questions. Otherwise, we wouldn't have known either. So
yeah.
We found out about it before Christmas. I don't remember exactly when it was.
And I take some blame for this, for not knowing this and distributing it. But at least I think we've intervened in time to shape this the way we want to. We got the big victory. I mean, there's a huge victory what we have. Yep. Now we just need to make sure we get the advocacy position in for our parents and professionals.
Yeah, and the hospitals, I was aware because the hospitals, both Stewart and March of Dimes approached the hospitals because of the change that this was going to require to the fee, especially in out years, because it's sort of uncertain as more and more, screening panels are added. It could impact the fee structure, and so the hospitals wanted to make sure that that we would be reimbursed by the payers.
Right. All right. So there's been I think Linus made a move for adjournment. Is there a second?
Second.
All those in favor say aye.
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 Opposed? Thank you for a great meeting. I think this is a very, very helpful meeting. Let's see if we can't move it through a little better with March of Dimes and get the language we need. As I said before, you're free to go to them as not as members of this committee, but as private citizens to express your views. I would recommend that you highly praise them for the first part that they've done, and try and influence them to make sure they do the right thing on the second part.
Good idea.
All right. Thank you.
Thank you. Bye.
Thanks,
Bye-bye.